Thank you for tuning in to the Healthy Project podcast, My City, My Health series. Don't forget, tickets are now available for the My City, My Health Des Moines. Visit mycity.health to register and join us for an inspiring and informative event. A big thank you to our presenting sponsor, Unity Point Health, for their continued support. Thank you for tuning in to the Healthy Project podcast, My City, My Health edition. I'm your host, Brooklyn Lowry, and I am so excited for our guest today. Maria, thank you for joining us. Before we get started, I wanted to give a brief introduction of myself. I'm currently an undergrad student at Drake University studying healthcare admin. I have a strong passion for health policy reform and advocacy for vulnerable and underserved populations. If my assumptions are correct, Maria, I am sure you have some of those same passions of representation for underserved populations. Why don't you give us the rundown of who you are and what you do?
Hi, and thank you for having me. So I am Maria Torres, but everyone calls me Maria in English. And I am the health equity coordinator for Pottawattamie County Public Health. And like you, it's about making sure that we are represented in some way, shape, or form. Being here for 23 years has taught me that we need that more than ever.
Thank you for sharing that. So how do you personally define health equity? And do you think this term might be defined differently based on individual life experiences?
So the way that I define health equity is, meeting each and every single person where they are at that moment in time. And yes, I think it's definitely something that we are, I keep saying this, but it's so true. We're not a one size fit all. So it's definitely something that is defined differently based on individual experiences.
Okay. That's a great perspective. So, to my understanding, you will be joining us as a panelist for the Immigrant Health and Healthcare Experiences at the My City, My Health conference this year. For those that don't know, this panel will focus on addressing mental health disparities in underserved populations. Can you share more about your personal experiences with mental health and how these experiences shape your approach to advocating for mental health in underserved communities?
So, first of all, I'm really excited about being a part of this conference.
Thank you for joining us.
And yes. So in my perspective, I am an immigrant. I moved here when I was 10 years old. Coming here and not knowing the language, not having the same rights as everyone else, it hits you. It hits you a lot. So my mental health illnesses started way back when I was a little girl. But just 2 years ago, I was diagnosed with PTSD, and that was with anxiety attacks, depression, and oh my God, what is the other one? See, I'm so used to just saying PTSD. I forget my own things. But yeah, so now is, the time where being an immigrant, especially in the community, for being a Latina woman, for me is always making sure that I mention mental health, because in my culture is so, God, how would you put it in words? Everyone is just so against it. If you, like, I remember my mom when I was younger, and I kept telling her, like, there's something wrong with me. Like, this does not feel right. She'd be like, you're crazy. It's going to be fine.
It's a lot of, this is fake. This is a mythical thing.
Yes.
Yeah.
So, especially I think for us people of color, that's like the main thing, right? You have to keep pushing forward, like no matter what. Like you have to keep going. You have to make sure that everything is taken care of, like everyone else, and then yourself. So after a while of going through undiagnosed postpartum depression, I'm like, nope, this is not right. And seeking help and finding out like what is actually wrong with me, it gave me like that feeling of like, I knew it, I was right. So now I have to make sure, that others know about it. Especially when we come from cultures that this is such a taboo thing. to talk about. We need to be more open and more like, I don't know, we just need to talk about it more. And growing up here and just being in a different country and not knowing the resources or not having resources at all, it is very hard to even trying to seek help is a
Yeah.
barrier. So
Yeah.
that's the reason why I'm like, I need to advocate more. I need to talk about it more because hopefully, I feel like at one point the right person is going to hear me and they're going to be like, how can we help?
Exactly. Yeah. I appreciate you for sharing your personal journey on that. I think the discussion of mental health is so important and that it needs to be promoted more. And especially with your personal experience of immigrating to a new country, that can definitely have its own effects that aren't discussed enough. So thank you for sharing that.
Oh, yeah. Oh, no
What
problem.
strategy have you found effective in promoting mental health awareness?
Using my voice. So before I used to be, if you would have asked me a year ago to even present or be on podcast, I'll be like, nope, no, thank you. Because I am an introvert at heart. I like
Yeah.
to just keep
And now
in
look at you.
and yeah, right. So just, and that's one of the things that I have been told. They're like, you have something to say it. Why aren't you talking? And I would be just so
Mhm.
afraid of, no matter what I would say, people wouldn't listen. Or maybe I was just talking to the wrong people at the time. But now that I have this voice, I'm like, I need to share it. Hopefully, those who need it the most will listen, and maybe they will use
Yeah.
their voice too. And I don't know. I'm thinking like the domino effect. Hopefully that would be the chain reaction when it
Mhm.
comes to mental health and just knowing like, look, if I'm making it, you can too. Like I didn't think I would be able to be this open with people, but now I'm like, let's talk. What do you want to know?
Yeah, and that's a great strategy to have. I think it's so important to use your voice, and especially for those people that don't have one. So I thank you for that. And then just going on that same topic of your personal experience, you did mention that your culture is the mental health thing is very taboo. How do you think someone could reduce that stigma, especially within immigrant communities?
Talking about it more. Education. I think that's what we can do. Unfortunately, when it comes to our culture, especially in the elder community, we're so very taboo focused that we forget everything else around us. The good thing about, the new generations is the pushing forward, like, why aren't we doing more? How come we're not focusing on
Yeah.
mental health and physical health? Why are we just focusing on one thing? So I love the new generations for that because, that was also a push for me. And having an 8-year-old, it's, I need to do more because when he
Hmm.
grows up, I want him to know that it's okay for a man to cry. It's okay for a man to feel down. Things happen. And in my mind, it's like, I don't want him to go through the things that I went through on holding things down and then having to deal with it later on through life. I'm much rather him deal with it as it goes and knowing and regulating his own feelings and emotions than waiting 20, 30 years to find out, I wish my mom would have said something, or I wish someone would
Yeah.
have told me that that was okay. So that's the reason why. So I'm grateful for the new generation coming out and saying like, what are you guys doing?
Right.
So it's good. It's good to learn.
We are making way. So I'm curious,
Yes.
Maria, did your perspective on mental health shift a little bit when you had your son, or has it always been the same?
It it shift. It shift a lot actually. Because at the beginning, I was just keeping everything down, just holding everything and thinking, it doesn't matter. I remember seeing my first therapist when I was 17 years old, around there. Uh, and I just remember telling her my story, and she was just crying. And as a 17-year-old, I thought, oh, I'm not going to talk to anyone about this because you pity me now. Like it was
Yeah.
just that sense of they're not understanding me, they're pitying me. Like it wasn't, I was more embarrassed to to talk about my story more than anything. And then, being pregnant and going through depression, and then postpartum depression, like every day it was, dreaming and thinking that I could hurt my son, and I would just start crying, and I'm like, no, I have to do something about this, because I was afraid. I was honestly afraid of, if I don't do something now, who's going to take care of him? And for me has always been like, no one's going to take care of him more than I will. Like, I am the one person that is going to love him more than anyone. And I need to make sure that I'm good, that I'm well. So that's the reason why I sought help. He was my why. He was my reason of, but there were points in my life where I'm like, I give up. I don't want to do this anymore. And when I had him and I was holding him, I'm like, I will do anything for this person. So the best thing that I could start with was getting better for myself. Because I think that now we are so focused into taking care of everyone else that we forget of ourselves. And that's why I'm like, I need to push more for people to know, like, if you're not taking care of yourself, you're not taking care of anyone.
Exactly.
Because you're depleting everything that you have. So
yeah. And you sharing that is so powerful, because I feel like so many people, myself included, have had those same experiences with therapists where you share your story and you do feel more like you're being pitied. And I feel like that's definitely a big thing that should also be talked about.
Yes,
so moving forward from that. Oh.
No, go ahead.
Okay. So moving forward from that, how do you think public health professionals and community organizations could collaborate to improve mental health services?
Advocating more. I unfortunately, there's not much that we can do as public health, but advocating, just using our voices and making sure that we have the resources available, the right partnerships, and the right collaborations. I think that's something that we need to strive for, especially, in, I don't know, in like the kind of environment that we're currently in. It would be nice to have that. So when people come in seek help, we're able to be like, hey, we don't have all of the answers, but here are some resources of people that are able to give you those answers.
Yeah. And finally, what advice would you give other public health professionals who are looking to advocate for mental health equity in their own communities?
To acknowledge the problem first. I think that we talk a lot about mental health and it's there, but we're not actually acknowledging the problem. It's more like, let's talk about mental health, but let's just talk about it. We're not going to do anything. And I think that we need to make sure that whatever we're doing is acknowledging the problem. And how are we going to go forward? How are we going to make sure that we're not only taking care of ourselves, but everyone else? And just keep advocating. I think that's the biggest thing. Just advocate. We need voices, and I think we need to work together. I have this thing of, if we're working together, we can do amazing and great things. And if we're not, then what's the point? If we're separately working with just because this is my community, I'm going to protect my community, we're not going to move forward.
Yeah.
I think that if we want to make a bigger impact, we all have to, I don't know, come as a tribe and just take it down. I don't know.
Collaboration.
Yes.
Collaboration is so important. I think even just using your voice to talk about mental health is just the first step in the actual mental health crisis. And there's so many more steps we need to take, one of which being to collaborate better to address that problem.
Exactly. You get it.
Well, thank you so much, Maria, for sharing your insights and experiences with us today.
First, can I say thank you so much for saying my name right? I appreciate that so much. Like, it touches my heart. Thank you.
Oh, of course. That makes me sad that you feel very grateful to have someone say your name correctly, because I think that it should always be said correctly. But
It's fine. Not everyone knows how to roll their R's. There's words in English that I don't know how to say. So I'm okay.
I can get Maria, but Torres, it's a little bit harder for me.
That's good. It's good. I applaud you. Thank you.